Yo,
Hello, knock knock. My name is Christian. I'm going to be your nurse for today.
how you doing, Christian?
I'm doing well, and we're going to do a quick assessment on your baby. Is now a good time?
That was a great time.
Cool. All right, so before we start, I'm going to get my hands washed, and I magically put on gloves super fast. Could you tell me your full name and your date of birth, please?
My name is Brittany Rogers, October 5th, 1994.
Cool. I'm just going to check your wristband real quick, just make sure it lines up. Cool. And can you tell me your baby's full name and your date of birth?
Her name is Ashley Rogers. Her birthday is February 5th, 2025.
Awesome. All right, so we're going to start the assessment first. First thing we're going to look at respirations, and we can do that kind of just by looking at the chest rise and fall. We do that for a full minute. So check for a full minute. Respirations are at 32 breaths per minute. That's great. And next we're going to check her lung sounds. So when we're checking lung sounds, we're going to check both anterior and posteriorly. We'll check for a full minute and listen to any adventitious sounds. I'm just going to warm this up real quick so it's not too cold for the baby. Just get it unswaddled real quick. Zigzag pattern. Again, we do this for a full minute, and I would also check the back as well. I got my stethoscope on. We're going to check her heart rate. And we're going to listen to her heart rate. So right here for a full minute. So I hear both S1 and S2 sounds, no adventitious sounds. It looks great. And after you count for a full minute, I got at 140 beats per minute. So that is totally normal. Get her swaddled back up. All right, before we start, anything else? How many times is are you changing the diaper per day for your baby?
At least 4 times.
4, so it should be probably around 10 to 12. So we're gonna have to talk to the doctor about that. So 10 to 12 per day is normal. And in terms of poops, how many times per day?
Like 5 times.
Well, all right, that's awesome. And that's totally normal. And now, how is your baby? How are you doing with feeding for your baby? Are you breastfeeding?
I'm breastfeeding.
Breastfeeding. You have no issues with latching or anything like that?
No issues.
You're doing that about 8 to 10 times per day.
Yes.
Yes. All right, that's totally normal. All right. So next, we're gonna do just check the fontanelles while I'm up here first. So we're gonna check the anterior fontanelle. The anterior fontanelle is soft, it's flat, not bulging. Usually that's gonna close up around the 3-month mark. We'll also check the posterior fontanelle. That's also flat and not bulging, and that usually closes up around 18 months. And while we're here and she got an arm out, we're gonna check the skin turgor. So check the skin turgor, there's no tenting, so I'd say your baby's well hydrated just based off my sight. And then we're gonna check some reflexes. So first one that we'll do is the palmar grasp reflex. She just grabbed my hand, that's nice. She grabbed my finger with her foot as well, that's good. We're gonna check the Babinski reflex, awesome, the toes fanned out. And we're also gonna check the Mora reflexes, have to see if she startles whenever I just drop her down just gently, and that is also normal. All right, so for our next trick, we are going to check the baby's weight. So we're gonna get her unswaddled here just for a little bit, I'm sorry. And we're gonna take off the diaper as well. And we're gonna make sure our scale is zeroed out. Yes, it is. And we're checking the weight. All right, weight says 4.2 kilograms, that's perfect. And we're also gonna check the head circumference along with that. I know this stinks, just bear with me, we'll be done in just a second. And we got her head circumference at about 34 centimeters. And we're also gonna check her length as well. Let's make sure she's completely flattened out. I'm sorry, sweetie. Get that down. And we got this at 49 centimeters, very good. All right, we're gonna put this diaper back on, get you off that cold scale. There you go. Put this back on. And kind of missed that one there, but that'll be fine. Oh, there it is. Good enough for me. All right, we'll get this baby swaddled back up. And one thing I almost forgot is that her skin looks totally normal. It's pink, healthy. She feels warm to me, so you're doing a good job, Mama. Get you swaddled up, make sure she's comfy. Just a quick safety check. You want to make sure that there's nothing in the in the crib with the baby, just because you don't want her maybe covering it with her mouth or getting injured, anything like that. Make sure she's close by. And before I get out of here, is there anything that you need from me?
No.
Nothing? All right, so like I said, my name's Christian. If you need me, just press that call bell. I'll be back to check on you later.
Awesome. Thank you.
Cool.